So just to provide you with some disclosures, so as Maureen said, I do work as a consultant haematologist at King's College Hospital. My specialty is looking after people with lymphoma, and I also do laboratory diagnostics. But in 2019, I also became qualified as a certified lifestyle medicine physician. Outside of my NHS role, I run 2 community interest companies. The one that may be of interest to you is Plant-Based Health Professionals UK, and I'll pop a website link in the chat afterwards, because you'll find some useful resources on there for free that in case I've sparked some interest. And I also run a lifestyle medicine service called Plant-Based Health Online, and I provide education on the topics I'm talking about today at the University of Winchester with some online courses that I'll come back to at the end. And I'm an author of a couple of books that I'll mention also at the end. But just to set the scene and just so to manage expectations, this is really not about blaming or shaming about individual lifestyle choices, behaviors. It's about hopefully empowering you with some more actions that you can take to support your own health and well-being. And often these tips can be shared with friends and family and have a ripple effect. So hopefully you'll be able to share this with those people close to you. This will be evidence-based, and that is the discipline of lifestyle medicine. It's based around the available evidence we have. The caveat is there's not a huge amount of data on lifestyle medicine and myelodysplastic syndrome. You all know you guys have a very rare condition, and when it comes to cancer and impact of lifestyle habits and lifestyle medicine interventions, it's usually in people with breast cancer, colorectal and prostate cancer, because they're the big 3, and of course lung cancer as well. And this really isn't about all or nothing. You know, after listening to me, you don't have to go away and try everything that's been suggested. It's just about actioning small changes in your everyday that are known to improve both physical and mental health and well-being. And as I've told you already, I don't treat people with MDS. I make the diagnosis down the microscope and in the laboratory lots, and clearly in my sort of 20+ career as a doctor, I've cared for people with MDS, but that's not my primary role right now. But I know lots about it because clearly King's has been an epicenter of myelodysplasia research, with Prof Mufti leading the charge for a long time. So what I am going to do in this session, around sort of 25-30 minutes, is provide you with an introduction to lifestyle medicine and some ideas about how lifestyle medicine could support people living with MDS. And so just to set the scene, and some of this may well be obvious, but to me, the figures are really stark. We are in an epidemic of chronic ill health in the UK and globally, and this is only getting worse. This is the latest report I've seen that was published in the Times Health Commission, just showing that more and more of us are living with chronic ill health. When it comes to people over the age of 65, for example, at least 1 in 4 people have 1 or more chronic illness. Yet we know that 80% of the illnesses we see in the National Health Service anywhere in the world could be prevented or significantly delayed if we paid attention to healthy lifestyle habits. This is obviously healthy diet, physical activity, smoking and alcohol. And that could eradicate 80% of these non-communicable diseases that are crowding out healthcare at the moment. And what this is resulting in is the fact that although we might be living longer and even our life expectancy has sort of plateaued and probably will be becoming shorter in the coming sort of decades, but we have sort of peaked life expectancy around 80 to 83 years, but we are spending up to 20 years later in life in ill health. So our healthy life expectancy or health span is around 63 or 64 in the UK, and none of us want to spend 20 years in chronic ill health. And when you look at the stats on common chronic conditions, and I accept that this has little to do with MDS, but just in terms of other conditions that people may have experience of, be suffering with, have family members with, you can just see the preventable aspect of these conditions. So 90% of heart disease could be prevented. Similarly with stroke, 40% of cancers. Dementia, 40% is due to modifiable risk factors. 90% of type 2 diabetes need not happen. And similarly for fatty liver disease. And I'll cover what these preventable factors are. And as I said up front, this is not about blame. Often lifestyle behaviors and habits are not necessarily down to choice, because it very much depends on our ability to access things like a healthy diet and green spaces, and have the time and energy to spend on mental health and well-being. But what the medical profession is rapidly realizing, and lifestyle medicine is the most most rapidly growing specialty within medicine, is that healthy lifestyle habits, known as lifestyle medicine, can really address the root cause of our chronic ill health. So these are the 6 pillars of lifestyle medicine: healthy nutrition, regular physical activity, avoiding toxins such as tobacco and alcohol, managing stress, focusing on restorative and good quality sleep, and usually that's 7 to 9 hours sleep during the night, and healthy relationships. And the American College of Lifestyle Medicine was the founding organization back in 2004, and now it's a global movement of thousands of individuals who've qualified with the international certification, like I've done and several colleagues, and implementing these lifestyle medicine pillars into routine practice, because it's relevant to all of us for prevention, management, and treatment of any condition that you may have. And the reason why these lifestyle approaches are so effective is because, as I say, they really get to the root cause of chronic disease. And we've got decades of data demonstrating that lifestyle interventions along the lines that I've mentioned can really address the key mechanisms at play when it comes to generating chronic conditions. So you'll see in yellow here the key cellular mechanisms that drive most of our chronic conditions, and some of this you will have heard of. So, the health of the microbiome is very topical at the moment, but all conditions are known to show adverse alterations in the gut microbiome. We know that rather than the genes we inherit, it's the expression of the genes that matters, and we can change that. So epigenetic changes can either support good health or create chronic ill health. And cellular stress, so things like that will damage our proteins and DNA, will damage the cells. And all of these yellow mechanisms here ultimately lead to inflammation, which is a key driver of many of our chronic conditions. But the good news story here is that you can intervene at any stage. You can intervene at this right-hand side where you've already got chronic conditions and reduce inflammation by intervening with lifestyle interventions, or you can intervene upfront, which would be the ideal situation, and try and prevent any of these chronic alterations in our cellular health. Now, you may realize by the end of this that I'm most passionate about the lifestyle pillar of nutrition, and it's also the one where you're going to find a lot of different narratives and perhaps confusion in the media. Often it's confusion by design, and it's the pillar that I get the most questions about, because I think nobody needs to be told that moving on a daily basis, regular basis, physical activity is good for health. But when it comes to what you should eat, there seems to be numerous questions and a lot of myths. So I just thought I would make it clear in lifestyle medicine what the college and founding college has put out as a statement. Oh, my slides seem to be changing themselves. It is an eating plan that's primarily based around minimally processed plant food. So a plant predominant diet or a plant-based diet. It's a plate that's half fruits and vegetables, a quarter whole grains, a quarter plant proteins. So plant sources of proteins will be things like soya and all its forms like tofu, but any beans, lentils, pulses, chickpeas, nuts and seeds. And then mainly water for thirst, tea and coffee if you enjoy it, they don't have a problem with that. And lots of herbs and spices, not only because it's delicious, but because they are full of antioxidant and anti-inflammatory properties. And the great thing about this type of plate, that it's adaptable to any cultural or traditional pattern. For me, it's simple, you know, a South Asian background. These foods are part of my everyday. And so how do we know that these healthy lifestyle behaviours or habits really do impact health? Well, if you've not watched the 3-part documentary on Netflix already, I urge you to do that as your homework tonight. So there's a 3-part documentary called How to Live to 100 and charts the work of Dan Buettner, who coined the term the blue zones. He was doing research and travelled around the world to find where people live the longest and healthiest lives and where there's more people reaching 100 years of age in good health. And he was able to find 5 blue zones. And this is a picture from Okinawa of a centenarian who's, you know, obviously able to function well and enjoying life. And what he was able to share about these 5 regions in the world where people live the longest and healthiest lives is that they share 9 factors in common. And that's listed here. So when it comes to diet, they eat a predominantly plant-based diet. They follow the 80% rule, so eating till they're 80% full. They spend time relaxing, they have a purpose, they move naturally, they have a sense of belonging in a community, they have the right tribe. There is some consumption of wine. We might come back to the issue of alcohol consumption. I have strong feelings about that, but it is true that in the blue zones, some of them do consume wine as part of a Mediterranean diet. And in the medical literature, we've again known for a long time, this is a seminal publication from 2009, that healthy living really does support us to prevent chronic conditions. So this was the large analysis of over 20,000 German participants in the EPIC study, which is the European Prospective Investigation into Cancer and Nutrition. And they were followed for nearly 10 years. And what it shows that if you paid attention to all of these 4 factors, never smoking, maintaining a healthy weight, healthy diet, physical activity, that these individuals had almost an 80% lower risk of developing chronic conditions. So that's the kind of 80% that I mentioned right at the front of the talk. So what does this have to do with MDS? Well, hopefully bringing this back to some relevance to you guys. So I think when it comes to any cancer diagnosis, and that's the same for MDS, we have the opportunity to intervene at 3 different time points. So prevention, treatment, and living well with and beyond a diagnosis of whichever cancer, be it MDS or other cancer that you have. So when it comes to prevention, there isn't a lot in the medical literature around lifestyle habits and MDS, but what is key is that it's a really powerful tool for preventing what we call comorbidities, so type 2 diabetes, cardiovascular disease, dementia, fatty liver, and all of these comorbidities, as they're called, can impact how well people do with treatment for MDS and beyond. So I think there's a really key area that individuals can focus on to try and keep heart, lungs, liver, etc. healthy using lifestyle approaches. And then there's the treatment of MDS. And I'm going to generalize here because what we know is in every cancer that's been looked at, that healthy habits such as healthy nutrition, physical activity, sleeping well, can really support people to get through treatment better, limiting toxicity, and in some cases, which is really exciting, allowing the treatment to work a bit better, and I'll come back to that. And then there's living beyond the treatment, and it's about improving quality of life, again, reducing comorbidities like cardiovascular disease and type 2 diabetes, and reducing your risk of other cancers. And unfortunately, having a one cancer diagnosis means that you're more likely to develop another cancer when you compare to the general population. Now, in my research around MDS, what was clear is that there are a couple of lifestyle factors that increase a person's risk of developing MDS. One is carrying excess weight, and the other is smoking. And again, this comes down to these shared mechanisms of chronic disease, because both carrying excess weight, so obesity, and smoking generate inflammation. Smoking, obviously, we know damages the DNA and proteins itself at a cellular level, but excess body fat is inflammatory, so the fat produces inflammatory cytokines, and we know that excess weight also negatively impacts survival in MDS. So trying to focus on healthy habits in order to maintain a healthy weight is really important. Now, what we also understand about MDS is that it's associated with inflammation and what we call immune dysregulation. So you may be somebody who has MDS with an autoimmune condition as well, because the two are related, or other sort of inflammatory conditions like disorders of the skin, for example, can arise because of this shared mechanism of inflammation. And we know that healthy lifestyle habits can really reduce the level of inflammation in the body. So all of the pillars of lifestyle medicine that I've mentioned has been shown actively to reduce inflammation in the body, and can also enhance the working of the immune system, such that you hope that your immune system helps to fight against the underlying cancer rather than attacking your own body. And so there are many treatments in development for MDS that target both the immune system and inflammation, and it's sort of called inflammasome. So I think there's a lot of sort of assumed evidence that we could reduce inflammation in our body by adopting healthy lifestyle habits. The other thing that we know is that people with MDS have a higher risk of cardiovascular disease. So this would be high blood pressure, heart disease, stroke, and again, this shared mechanism of disease. And we began to realize this with this condition called CHIP. I don't know whether you're aware of it, but it's clonal hematopoiesis of indeterminate potential. So this is where you can find the mutations associated with MDS in a person, but they haven't developed MDS. And these mutations are prevalent in around 10% of people over the age of 70. So a lot of people will be walking around with these MDS-like mutations, but not everyone will develop MDS. But people with these mutations have a significantly increased risk of cardiovascular disease, and that's their biggest threat. And so really we do have to pay attention to our heart health and our blood vessel health, because it can adversely impact outcomes for people living with MDS, and also makes our lives more difficult for delivering treatment if you've already got high blood pressure and heart conditions. And so we should really be paying attention to cardiovascular risk factors. And as I said at the beginning or at the start of the talk, 90% of heart disease could be prevented if we paid attention to these 9 risk factors. And we've known this for decades. This paper was published in 2004, that 9 factors of which we have control over. For some of them, abnormal blood lipids such as blood cholesterol, high blood pressure, diabetes, excess weight, fruits and vegetables, alcohol being a negative factor, so not consuming alcohol, not smoking, and physical inactivity. And of course, there are psychosocial factors that we do need to address within society as a whole. So type 2 diabetes, again, this can be a problem for people living with MDS. So as you know, type 2 diabetes affects everybody, as in like every organ of the body, because glucose dysregulation, having high blood glucose, is damaging to cells and their proteins. And so having organ damage such as kidney disease or liver disease because of type 2 diabetes makes things much worse for people with MDS. And also we find it difficult to manage cancers when there's abnormal glucose regulation. And there are studies to show that glucose dysregulation or type 2 diabetes can negatively impact outcomes for people living with MDS. But when it comes down to the true cause of type 2 diabetes, it is really down to our westernized lifestyle. And this huge study, actually looking at 184 countries around the world, basically showed that 70% of new cases of diabetes were down to a suboptimal diet, because our diets are too high in refined grains and sugars, and also red and processed meat, and too low in all the healthy plant foods that I showed you at the beginning. We're just not eating enough fruits, vegetables, whole grains, beans, nuts and seeds. In the UK, only 28% of adults consume 5 portions of fruits and vegetables a day. And for children, it's even less, so 18% of children. So we've got a long way to go to improving and reducing our risk of type 2 diabetes. And MDS, there's an increased risk of second cancers as well. And these are the more common cancers like breast, lung, colorectal and prostate. And we've got very clear guidance from the World Cancer Research Fund about how we can support ourselves to reduce the risk of any cancer. And these recommendations come from 2018. As I say, World Cancer Research Fund, there's 9 recommendations. Be a healthy weight, be physically active, eat a diet rich in fruits, vegetables, whole grains, beans, nuts and seeds. That's a plant-based diet like I described. Limit fast foods and sugar-sweetened beverages because they contribute to excess weight. They also increase our risk of other chronic conditions that I've mentioned today. Limit red and processed meat. I'd say avoid red and processed meat. There is no need for these foods in the diet. Processed meat, such as sausage and bacon, is a group 1 carcinogen. It's a direct cause of colorectal cancer. Red meat, such as beef and lamb, are a probable carcinogen. They probably increase the risk of colorectal cancer. Limit alcohol, I would say avoid. I think there's no place for alcohol in the diet, but we can come back to that because I know it can be a contentious topic. Don't use supplements for cancer prevention. And that's really referring to the fact that higher than nutritional doses of any supplement have never been shown to be useful, and in some cases can be harmful. We should be aiming to get all our nutrients from our foods we eat. The caveats to that are a vitamin which should really be called a hormone, vitamin D, which I hope everyone is taking now, because in the winter months in the UK, it's recommended that every citizen take a vitamin D supplement between October and March. And I suspect if you're living in Scotland, like Maureen, you probably need it all year round as well. If you're a mum, breastfeed if you can. That's one of the other recommendations, because breastfeeding reduces the risk of breast cancer and type 2 diabetes in the mum, and there's better health outcomes for baby as well. And after a diagnosis, follow these recommendations because they're associated with better outcomes, improved quality of life and so forth. And it's no surprise to me anyway, that 5 of these 9 recommendations are related to dietary factors, which is why I'm so passionate about promoting healthy diets. And then just coming back to chronic conditions and how well people live and survive with a diagnosis of cancer, including MDS. Well, we know that having any additional chronic condition can impact your survival from MDS, and that things like second cancer and cardiovascular disease are genuine concerns and causes of death in people living with MDS. So it's a really good idea to try and pay attention to these risk factors that I've been mentioning. Now, I want to come back to the gut microbiome because I'm sure you've heard about this, and I know Maureen's also passionate about looking after her gut bugs. So basically, the story around the gut microbiome has really developed when it comes to cancer care, because what's becoming clear is that people with a healthier gut microbiome respond better to anti-cancer treatments, have a longer remission, and may even live longer following the treatment. And this is mainly related to cancer treatments that act by modulating our immune system, because 90% of our immune system resides in our gut. So we've got studies, quite a few actually, in people who've undergone stem cell transplantation, demonstrating that those with a healthier gut microbiome have lower rates of graft versus host disease and have better or longer remissions and less toxicity. Now, anyone that's had any treatment in hospital know that hospitals are a place that really kind of knock out your gut bugs. You'll end up on antibiotics. You may not have a choice of an abundance of healthy plant foods. And so we're really sort of needing to concentrate on our gut health on a daily basis. And the good news here is that studies have shown that within a few days you can benefit your gut bugs by adopting healthy diet and lifestyle, and all the pillars of lifestyle medicine can impact positively your gut microbiome. And so here I've just highlighted that really the key factor in maintaining our gut health is our dietary intake. And what happens is that the gut bugs that we have use the fiber particularly, but also polyphenols in brightly coloured fruits and vegetables to grow and proliferate, so healthy bugs can find a good home in our gut, and they form these metabolites called short chain fatty acids, which we know can stimulate our immune cells in a good way, but also they communicate with every single body organ. So there's communication between the gut and the brain, and hence the connection between food and mood, but there's also connection between the gut and our lungs. And this came to the forefront for me during the COVID pandemic, when we knew that the health of the gut microbiome resulted in a less severe COVID infection because of its ability to reduce inflammation in the lungs, for example. And those who like reading papers and reviews, I'd highly recommend this paper. Tim Spector's one of the co-authors. It's called, I mean, it's obviously addressed to the oncologist like me, but the gut microbiome, what the oncologist ought to know. And here you've got in the corner what dietary interventions people like me who look after individuals with cancer should be recommending. A diversity of plant foods, lots of polyphenol-rich fruits and vegetables, dietary fibre, which is obviously only found in plants, and fermented foods such as kimchi, sauerkraut, and so forth are useful to incorporate in the diet because they have live healthy bugs in the food. Now, I just wanted to, and then maybe in the last 5 minutes, just go over to exercise. Now, as I say, you'll realise that I love talking about diet and healthy nutrition, but actually everything I've said can be translated over into physical activity, and anything you do is better than nothing. So just moving naturally is better than sitting on a chair or on the sofa. And a recent study showed that even 10 minutes a day of physical activity can positively impact so many aspects of our health. And on the left, you can see that we should be aiming for 150 minutes of moderate intensity activity a day. So this is something that will make you breathless and a bit sweaty and get your heart rate up, but you'll still be able to talk, but you might not be able to sing. And then if you want to do less and more vigorous activity, then 75 minutes of vigorous activity where you're going to be breathing faster and difficulty talking, and as well as singing, and you wouldn't really be able to talk to the person that you're doing that activity with. We should be doing this every week, and at the same time also twice a week doing some strength building activity, so resistance exercise to support our bones and our muscles. Our bone mass starts to deteriorate from the age of 30, so it's really important. And we know in all the studies that have been done that there's numerous benefits of physical activity for every single function in our body. And when it comes to exercise, there's a nice consensus statement from for people who are living with and beyond cancer that regular physical activity, there's strong evidence that it can reduce anxiety and depression, it can improve fatigue, it can improve quality of life and physical functioning, and it's probably good for your bone health and sleep health as well. And another study, this is in people with breast cancer. I think some of you who've had chemotherapy will relate to this phrase known as sort of chemo brain, where during treatment you feel and after you feel like your brain function is not normal, difficulty with memory, concentration, plus the fatigue. But this study in people with breast cancer showed that people meeting the physical activity guidelines that I've shown you before and during chemotherapy had significantly less problems with the so-called chemo brain, because it comes down to reducing inflammation and oxidative stress that invariably the treatments we give you generate. And what I'm talking about is not new or sort of woo in any way. This is in our medical guidelines already, so you may well have heard that NICE have recommended physical activity as first-line management for mood disorders such as depression. So this is for mild and moderate rather than prescribing medications. Physical activity has better efficacy than medications, with obviously zero side effects other than positive, unless you get an injury, of course. And then first-line treatment from the NHS now for sleep disorders, which are really common in people living with cancer, is this app called Sleepio. So if any of you are having difficulty with sleeping, have a look. It's a sort of cognitive behavioral therapy online for people with sleep disruption. And I just wanted to highlight an area of oncology care that's really coming into the fore. We've now got the British Society of Integrative Oncologists as well, so BSIO. I'm not an expert in integrative medicine, but what it involves is using all the tools we have alongside conventional medicine to improve health and well-being. So this alongside conventional pharmaceuticals, lifestyle medicine, there's complementary and alternate medicine. And this is all getting into the main guidelines. So this is from the American Society of Clinical Oncology for managing pain in people with cancer, that they recommend that there's enough evidence for us as oncologists to recommend acupuncture, reflexology, massage, and hypnotherapy. And this can reduce the use of conventional pain medications. Similarly, for anxiety and depression, physical activity, yoga, mindfulness-based activities, they're all recommended in this joint guideline with the integrative medicine physicians. And then we do need to think about living well beyond the cancer diagnosis. And I just thought it was useful to highlight again the positive impact on healthy lifestyle habits on reducing the risk of cardiovascular disease and type 2 diabetes. This study uses data from the UK Biobank with 35,000 people with cancer followed for 14 years, and about 1,000 of them had hematological cancers. And they looked at the impact of 5 healthy lifestyle factors: not smoking, adequate sleep, healthy diet, which was one that was rich in fruits and vegetables, regular physical activity, and moderate rather than excessive alcohol. And they showed that with every single lifestyle factor that you added, you had a 10% reduction in developing heart disease or type 2 diabetes. And if you had all of these healthy habits, then you could reduce your risk of cardiovascular disease and type 2 diabetes by up around about 40%. And I just thought I'd point out, again, my favorite topic, healthy plant-based diets, that during the COVID pandemic, when there was the Zoe COVID app study going on with Tim Spector, that they were able to show that a healthy plant-based diet, like I showed you, fruits, vegetables, whole grains, beans, nuts, and seeds, was able to reduce the risk of severe COVID by around 40%, which is quite impressive, and is probably related to having a healthier gut microbiome. And I can't let any talk go by without mentioning the climate crisis and the biodiversity crisis, because this is impacting everyone's health now. And, we only have to look at the hot summers we have, the excess rainfall, the flooding, to know that we are experiencing the impacts of climate change right now in the UK. And there clearly are no healthy people on an unhealthy planet. So when we talk about our lifestyle habits, we do need to be mindful of what's good for planetary health as well. And there's no conflict there. What's good for us is good for the planet. So active travel, reducing car use, eating healthy plant foods, moving away from animal foods, they're all going to help mitigate our carbon footprint. So I hope in this very short period of time, I've demonstrated to you what lifestyle medicine entails, that the interventions may be useful for people living with MDS. More studies would be nice, but in the meantime, there's absolutely no side effects, with only benefits up for grabs for trying to implement healthy lifestyle habits into our everyday. And so some of my top tips that perhaps you want to ask about, and for me, it does come down to having a healthy diet as the fundamental, eating a variety of plant foods. 30 different plant species a week has been shown to result in a healthy gut microbiome. Swap out your meat for beans. It's such a positive step to take. Try soya in the diet: tofu, tempeh, edamame, soya milk. Use lots of herbs and spices because it's delicious. Add a portion of nuts and seeds to your daily snacks because they are really good for heart health. Start exercising. It's not necessarily exercising, just any physical activity, whether it's within the house, gardening, a dog walk. And for me, avoiding alcohol is really key to supporting gut health, reducing inflammation, and maximising lifestyle habits. This is what I do outside of the NHS. So I run a course on plant-based nutrition at the University of Winchester. I've just launched this new course and that's started to run this term on lifestyle medicine for cancer prevention and survivorship. And I think it's one of a kind and a university-based course for health professionals. So do point your physicians to this course. If anyone wants to learn more about healthy plant-based diets, there's free resources on my website. You're welcome to scan the QR code, and this will give you 21 days of daily emails to your inbox. And we have a podcast called In a Nutshell, 2 GPs talking about healthy plant-based diets to restore health and well-being for ourselves and the planet. And these are 2 books, so you can just Google my name on wherever you buy your books. As I say, I mainly focus on healthy plant-based diets. And I think that's me done. Thank you.